Or if you had an angiogram where there's an incision in your groin, you'll want to wait till that closes up before putting a lot of pressure on that area. So those would be the only two caveats to the position. Intimacy and exercise. So if you exercise 3 times a week, which is kind of bare bones recommendation, we'll get more into detail about exercise, the likelihood of an adverse event when you're intimate goes down even further. So we use the term METs to measure how much activity somebody is doing. And I'm going to get into this a little bit more detail. Just know that intimacy is considered very light activity. When I break down exercise in more detail, we'll talk more about what METs mean and how different METs equate to different physical challenges on your heart and the rest of your body. So some physical complications that could occur if you start to feel fatigue, depression. I haven't heard that in terms of exercise, but let's say you're feeling emotionally down, or you're having side effects of the medication or progression of the disease. This can affect obviously your performance, but you might want to have a conversation with your doctor if you feel it's warranted. If you continue to have issues that affect your libido after 3 months, then treatment is recommended. You can see, like on the next slide, it talks about a sex therapist or a psychologist. If you're considering taking some medications, there is a slide coming up about how those potentially interact as well. So it's always best guided by a doctor if you're feeling you're having some concerns. Return to normal sexual activity within 3 months. So it might be wise to take a little hiatus from intimacy just to take the pressure off of what you're doing, and you want to enjoy this with your partner. But you should get back into the regular swing of things as soon as you both feel ready, and that goes back to that open communication. As physical health and confidence returns, it'll feel more natural anyways. Okay, so if difficulties do persist though after 3 months, you can seek extra help, and the GP or family doctor can make an appropriate referral for you on that. So your natural responses, what can you expect by increasing your activity and getting ready for intimacy? Well, your heart will be faster. You have hormones circulating that send signals to your body to prepare for what you're about to do. So your heart will beat faster and harder, and that's a normal response. You don't need to be worried that your heart is doing something that it shouldn't be. Breathing will be faster. Also a regular response to exercise and increasing your exertion. Your skin being more flush and moist. So you're going to increase your circulation, and your body's going to try and cool itself as your heat is increasing. These are all normal, okay? Not signs that the heart is straining. Some abnormal symptoms that you might encounter would be severe breathlessness. So if you're still feeling a little bit of angina, which is chest pain, or short of breath, even at rest, then you would defer engaging in any exercise, including intimacy. If you have an irregular, excessively fast or irregular heart rate, so if you feel it's skipping or bounding or pounding, and you're just doing very light activity, that is an irregular response as well. Chest pain, jaw pain, neck pain, pain down the upper mid-back area. Think back to when your event occurred, and if you have any symptoms that feel similar to that, then that would be more indicative of heart. So some guidelines to follow, some recommendations. Some people have like a reflux-like sensation, and that was diagnosed as angina, but to avoid thinking it's gastric upset or something, don't eat within an hour of being intimate or starting exercise, and don't wait more than 3 hours to have some food before you engage in any physical activity, because you want to have nourishment and nutrients and energy for what you're about to do. It requires energy to burn energy. So if medications are required, take them before being intimate. So if you're meant to, for example, if you're on a nitro spray and you're told to pre-spray before activity, then do that before becoming intimate, because it is a form of activity, exercise. Slowly start and warm up, just like you would for an exercise session. Gradually build into the activity that you're going to be doing. That's going to benefit your heart, but also probably your experience. So That's the build-up and lead-in. If the concerning symptoms should occur during the act of intimacy, then let your partner know right away so that it's not a big shock or surprise and you don't continue on trying to upkeep certain expectations. Let them know, reduce the workload, if it's chest pain, then you're gonna, after stopping, if it persists beyond 5 minutes, you take 1 spray of the nitro. Spray off into the air to prime the pump, and then under the tongue, not on the teeth because there's no blood vessels in the teeth. If it's not angina related, then just rest, and it should go away within 5 minutes of rest. So if it's shortness of breath or an irregular heart rate, and if it doesn't, then you need to call 911 because it could be a heart attack. Okay? But let's say within 5 minutes everything goes back to normal, you feel fine. Go back to the activity you were doing, but just go a little bit easier. If it does reoccur, stop, tell your doctor about it, don't resume it again for that day until you speak to your doctor. Okay, and if the symptom is not resolved by nitro, let's say you had chest pain, you rested, it didn't go away, 5 minutes later you took a nitro spray and it still didn't go away, then you're going to want to call 911 as well, okay? And take another spray at the 10-minute mark. If, well, the nurses usually tell about a study, so I'll share it with you guys. Viagra and Cialis, the reason they don't want you taking that with nitro sprays because they were originally developed with college students. They were testing the effects to see about its blood pressure lowering capability. Coincidentally, they found that it had a different positive side effect. So now you know what they're used for. They're used to increase your arousal and keep you excited. So that's what they stumbled across, and now that's how it's coined. But just don't forget, it's also used as a blood pressure lowering. So if you're on blood pressure medications and you take that, and you're on nitro, for example, all three of them can cause you to be hypotensive and cause you dizzy or loss of consciousness. Okay, so it's recommended also to talk to your doctor if you're thinking of incorporating Viagra or Cialis. Okay? So a long list of references there. Just know that we've cited our work here. Any questions about the intimacy portion of the talk before I move on to the exercise portion? Okay? So
That was pretty picky.
I thought so. I didn't mention it at the very beginning, but there's a link posted up here, and we can write that down for anybody who wants it. Or you can just go to YouTube and search Cardiac Rehab Fraser Health, and you'll see all the lecture series. They would have given you this link already at the intro session too. But because you couldn't see it on the big screen, if you wanted to review it again or look at the slides again, that's where you could find it all, right? So this disclaimer is just to say that what I tell you today about exercise is not prescriptive. I'm not saying for each individual person this is what you need to do. I'm trying to provide some information so you guys can paint a picture of what is normal exercise for somebody after an event. And to get more specific, attend our cardiac rehab program or have a conversation with me up at the front and we can get more into the specifics. When it comes to questions in the audience too, like around exercise, try to not have it specific to your deep situation. If you have a lot of comorbidities and issues that make it complicated, let's try to keep the question related to some of the content we're discussing that can benefit the whole group. But I'll take questions all along the way if you have it. All right, so the main objectives and things I want to accomplish by giving you the information today is distinguish the difference between physical activity and exercise, because there is a difference when it comes to your heart health. Look at the impact on the risk factors. So you've probably up to this point gotten some information about the things that have led you to be here. What can you do about it, and how does exercise affect each one of those things? How can you prepare for a quality exercise session? And then when it comes to preparation, we like to use functional testing to see what your level is. So how many people in the room have done a stress test?
The treadmill thing?
Yeah, walking on the treadmill, graded exercise test, walking test, exercise tolerance test, stress test, a bunch of different names, all for the same thing. So that is very beneficial to understand what your level of capacity is now after you've had a hard event and perhaps some intervention. So we use that though to plan your exercise safely going forward. Type and amount of exercise. We want to talk about, okay, well, how much should I be doing to meet the requirements or the recommendations so that I don't run into heart trouble again in the future? And then if I do run into trouble while I'm doing my exercise, how can I manage that? That's what those special considerations, symptoms, and symptom management will be about. Okay, so on to the difference between physical activity and exercise. I'll basically define them as this. Physical activity is going to be random body movement that you need to do without any intention or focus on developing a certain bodily system. So if you have a job that requires you to move a lot of load, climb a lot of stairs, walk a lot, stand a lot, those are all forms of physical activity and very beneficial. In fact, they can help contribute in reducing risk for disease as well. But they don't check the same boxes that exercise does, because exercise is planned, structured, it identifies a body system and it stresses it to a point that it causes change to that system. When we're looking at the effects of exercise on risk factors, maybe I'll just wait till this code announces that.
Medical daycare, level 1. Code blue, medical daycare, level 1.
Okay, so when we're looking at the
Medical daycare, level 1.
So the risk factors, these are the ones on the left listed that you can modify. That means the ones that you have an impact or control over. And if you look at the list, that's quite an extensive list of things that are related to heart disease. Exercise impacts each of those things either directly or indirectly. So when we're looking at diabetes, exercise helps control our blood sugar. If we're looking at high blood pressure, we release hormones that, yes, while we're exercising, the blood pressure goes up. That's a normal response, but it remains lower for the rest of the hours between then and when you exercise again. So it helps with blood pressure control. Obesity. We all know that exercise expends energy, so you won't be storing that energy. So it affects our body weight or body mass. Inactivity. Clearly, if you're being active, you're not being inactive. So that's self-explanatory. Stress. Because of the hormones that we release when we exercise, some of them affect the brain and the brain functioning. It also causes the system to relax after and potentially sleep better. High cholesterol. When you exercise, that's one of the only ways you can increase the good cholesterol, or HDL, which has a direct impact on lowering the LDL, or the bad cholesterol. Preparation for exercise. This has to do with our environment. So when you're in warm environments, you'll prepare differently, obviously, than a cold environment. You may need to add breaks in the exercise because the intensity, even though you're not necessarily working harder, is going to be higher due to the thermal or temperature effect. Causes you to lose body water, it causes your blood pressure to change. So you might want to decrease your intensity as well because you need to do less to burn the same amount. The opposite is true for a cold environment. Instead of adding breaks, you might have to extend your workout or increase the intensity a little bit. You'll want to warm up a little longer. Back to warm weather conditions. Consider the time of day. You don't want to exercise in the peak, hottest point of the day. Same thing with the cold weather. You won't want to exercise in the most intensely cold part of the day. You might choose the midday. In the warm weather, you might want to wear light layers and take layers off. Change out of clothing as you get wet in cold climates. Stay hydrated in hot climate, or wear appropriate footwear in cold climate to avoid slips. Now, this is going to be for kind of any exercise session, but specifically we're looking at a cardio or walking session. Does everybody know the difference between cardio exercise and strength exercise? We're going to talk about that in a moment. But either version of exercise, whatever you're doing, you want to prepare the body for that activity. You may prepare differently depending on what you're doing. If I'm going for a walk, and I'm going to challenge my heart on that walk, I'm going to want to use walking as the version of my warm-up. I'm going to walk at a lighter intensity than I plan to work at in the working zone. What's the appropriate intensity? Well, if you haven't done a stress test, we can use a talk test. I'm going to get to that now. Oh, it's coming up. I'll explain it because it's on here. You're going to use a talk test. So you can comfortably talk, sing, and whistle when you're warming up, and at the end of your exercise when you're cooling down. In the middle, when you're stressing the body more and stressing the heart more, you're going to want to have a challenge level where breathing interrupts your talking. You can still talk, so you're not breathing that successively. That would mean not that you're having a heart event, but that you're probably overexerting or working too hard. Wow. Is that a ringtone? Testing and using your functional level. So I mentioned the stress test. A lot of you raised your hands that you've done stress tests. Well, this is more specifically why we use them and how we use them. So when you do a test, you can expect that it'll be a stage protocol where you'll each stage try and complete a level. Sometimes I hear the expression, oh, I did good, or I completed the test. Well, those things get evaluated. Well, for one, you never complete the test because the 3-minute stages or whatever minute stages you're doing, they can go indefinitely. What we're looking for is a breaking point or end point in you. So when you reach a termination point that you feel like, you know what, that's the hardest I can push myself, that would be the terminating criteria. Or if there's still something going on under the hood, they would stop the test because they've identified that. Those are the 2 reasons you stop a stress test. Not because, oh, you did stage 3, that's the end of the test, you're done. It's not the case. What I recommend to most people, if you haven't already done your stress test and you're going to do one, try to push yourself as hard as you would ever want to push yourself independently. Okay, because you don't want to go away from this test, go back to your job, go back to life, and do something physically challenging that has not been supervised following your heart event. You want to be on the ECG monitor with a cardiologist and a code and crash team present when you're giving yourself your best push. And if you feel like, well, you know what, this is happening so close to the time I had my event, I'm not going to have a very good performance here. I'm going to peter out too quickly. Don't worry about that, because you know what? Whatever heart rate level you reach on that test is not going to change no matter how fit you are. What is going to change is how much your body can tolerate before you reach that heart rate level. So we're still stressing your cardiovascular system the same degree as when you're at your best fitness level and pushing yourself to your limit. Does that make sense? Okay. So what we take out of it as exercise specialists is, how fast did your heart rate go to? And what is the metabolic level that you reached? Now I'm going to talk about the metabolic level a little bit more because I mentioned that in the intimacy lecture. So what is a met? All of you sitting here right now require energy to do what you're doing even though you're resting. Because if you think about it, there's a lot of body processes that happen without your effort, such as thought, heart beating, digestion, breathing. All these things happen whether you're consciously doing them or not. And in order for those processes to occur, we're using energy. So that energy is called your metabolism. And you can kind of view MET as short for metabolism because you're working at, now we're talking about it as a unit now, 1 times your metabolism or 1 times your resting energy rate. You guys follow me so far? Okay, because now is how we're going to use that to evaluate other activities. So intimacy is usually 5 or less METs, which is considered light to moderate, okay? Activities that are 3 to 6, and I'm just going to skip forward. Oh, I don't have that slide anymore. We had to trim the lecture a little bit. But if you're doing something that's a little more vigorous, let's say climbing stairs, scrubbing or mopping, those types of activities would be more in the moderate category, 6 to 7 METs. Getting heavy is going to be carrying low climbing stairs, or doing sanding or sawing, or more heavy and physically intensive exercises. So every activity that you do has a metabolic demand associated with it. And if you score higher on your metabolic level, because like you're probably thinking, well, why do I want to push myself to see how hard I can go? Well, a lot of you want to go back to a certain activity. Let's say it's playing hockey, for example. If you want to get back to an activity and you know what the level of metabolic demand associated to that activity is, you want to make sure on your stress test you're scoring higher than that. Because if you are, you know that's within your physical ability and safe. And that's one of the best defining criteria for can I get back to my physical job is, well, what is your functional capacity? Does it exceed what your job requires? Then we know we're not overburdening your heart. Okay? Well, what if you can't do a stress test? Because not everybody, maybe somebody has hip replacement or bad knees, arthritis, and they would be a limiting factor long before the treadmill is done, or that your heart is the limiting factor. So what do you do then? Well, you go back to what I was talking about this intensity scale or that talk test. Because even though you can't go on the treadmill and find out what your max level is, you can get a pretty good idea of where you are on the exertion scale by looking at what your breathing is like. If I already gave an example of the breathing pattern, but if I can talk, sing, and whistle, no interruption in my breathing by my mouth, I'm likely in a light zone, or around 30% probably of my heart rate reserve. As I get to 50 to 70% of my heart rate reserve, which is where most cardio exercise is done, there will be a little bit of effort to talk. My breathing will be interrupted by my mouth. A very quick self-assessment, if I can cover my mouth with my hand and do my exercise only breathing through my nose, I'm probably underexerting on my exercise. And then remember, that's the middle portion of the exercise, the training zone portion, where you're supposed to challenge your heart muscle. And how do I know if I'm doing too much? Well, if your breathing is rapid enough that you can't talk at all, or just squeeze 1 or 2 words in there, then you know you're probably in your 75 or greater % of your heart rate capacity. And that would be considered overexertion. Okay? So even if you didn't do a stress test, there's some self-assessment tools based on your breathing pattern that we can use. Okay, so let's talk about type and amount of exercise now. When we're evaluating, in fact, when you come and visit me at the table here and you say, what should I be doing for exercise? Or what's safe for me to do for exercise? One of the first things I'm going to ask you is, what are you currently doing? Because I want to see what you're able to tolerate before I make any further recommendations. If you're not tolerating what you're currently doing then you have to regress it a little bit. But we still plug it into this formula. Frequency, or how often, intensity, how hard is it, time, how long do you do it, when do you do it, and type, what mode of exercise are you picking to do? And then we can look at putting it all together and how much volume or the amount of exercise that you're getting in a week. Is it close to the recommended amount? And then if you're reaching it and it's no longer challenging you, how do we make it harder? And that would be the progression part. So this is a very busy slide with lots of content. It used to be a number of slides. What it does is it gives you some guidelines or ranges for each of the types of exercise. So before I asked you as an audience, if you are aware of the difference between cardio or aerobic exercise, the terms are slightly interchangeable, and strength or resistance exercise. And the main difference is how long does it take your body to tire while doing the activity? If you do a movement that tires your body out in less than a minute, it's a strength exercise. If you do an activity that causes you to tire, or you can sustain it, it's challenging you, but you can sustain it for an extended period of time, it's going to be aerobic or cardio exercise and work on your heart. So when it comes to the type for cardio, and heart exercise or cardio exercise is where you want to spend the bulk of your concentration as cardiac rehab patients, you're going to want to do it at least 3 days a week. You can go more frequent than that because this system recharges or replenishes itself. You want to get your heart rate in that zone you talked about, so moderate to heavy effort, 50 to 70% of your reserve, or more rapid breathing, but you can still talk. 20 to 60 minutes is the range. Start with 20, build up to 60. And don't jump too quickly when you're making your progressions or adding more, 5% to 10% maximum per week. And you only change one variable at a time. Don't change both how hard you're doing it and how long you're doing it, both in one shot. And so continuous full body, the more of your body you're engaging in a movement, like walking with an arm swing, you're going to be using more METs, or you'll be metabolizing higher or burning more energy. You'll also be getting the heart muscle to work harder to pump to multiple areas, as opposed to just moving your arms or just moving your legs. So when you say, which is the best version of exercise, I don't really like that question because everybody has to do different versions at different times. But if you have a choice and you have the ability, full body movement like walking is a fantastic exercise. But you have to do it to a level that stresses you enough. Okay, and then the total amount per week is 500 to 1,000 METs per minute per week. Basically what that's saying is you don't have to go quite as long if you're going harder, or you don't have to go quite as hard if you're going longer. But you want to try and do about 150 minutes of cardio training a week at least. All right, looking at strength exercise. So strength exercise, again, is tiring the muscles out, specific muscles, in less than a minute. You want to do that type of exercise 2 or 3 days a week, and you don't want to do them back-to-back days. Cardio you can do almost every day, walking, for an exercise version of walking. For strength exercises, you want to spread it out. Allow the body recovery, because when you're doing strength movements, you're lifting a load, tiring a muscle group out. And don't think about bodybuilding here or muscle bulk. We're just thinking about keeping the muscles you've got, preventing muscle wasting, and also making it easier for your heart to circulate to areas, because you get more vascular density in areas that you condition. Okay, so when you're doing strength exercises, you're causing little, it's called micro tears, in the muscle cells themselves. So you're not actually enlarging the muscle when you're lifting the load. You need to allow the rest period between, in the recovery phase, for that tissue to remodel itself and become stronger than it was before. The heart tissue works very much the same way. That's why we want to stress it enough that it's causing change to the muscle of the heart. How do you do that? Well, you pick a movement that you can lift a load 10 to 15 times, going 2 to 4 seconds in each direction. A lift phase and a lower phase, maintaining your breathing, maintaining good posture as you go. We will give you more specific examples of movements and how to isolate each body area if you come in our cardiac rehab program. Okay? You can do it with a variety of different equipment. You can use strength machines, strength cable systems, body weight, resistance bands, medicine balls. There's all kinds of different ways you can put load on the body. And the bottom line is the muscle doesn't know. It doesn't have a brain in it that it can discern a difference between a kettlebell versus a machine. The difference is well, the muscle can't tell the difference. The brain processes it differently, and there can be some slightly different physical responses. Either way, you're loading it, and you have to overcome that load, and that's the most important part about that. If you're doing 8 to 10 exercises, which covers the full body, it will take you 10 to 15 minutes. And if you do that routine 2 to 3 times, you're checking that box too. So I spend a lot of time on those 2 categories because those are the most involved. Flexibility is just taking a muscle to its lengthened position. So if I'm doing a bending exercise for my bicep, I'm shortening the muscle that crosses the arm just against load to strengthen it. To stretch it, I'm doing the opposite. I'm going to lengthen it. But I don't just lengthen it repeatedly. I lengthen it, and I can use something else external to cause me to turn even more. And then when I feel the pull in the area, I hold that position and I count. I breathe nice and slow and deep. Because this type of exercise is meant for recovery and is best done at the very end of your exercise session. You'll want to pick exercises that match what you did for your cardio and your strength exercise. So if you've done leg-involved exercises that involve the hips and the knees, then you'll want to choose stretches that stretch out the hip and stretch out the muscles that go across the knee. Okay? Again, specific examples come when you attend our exercise program. Special considerations. So I'm sure many of you in the room can put a hand up to these different conditions here. In fact, so who here had an open heart procedure? Quite a few. Okay. So for an open heart procedure, the guidelines for resuming exercise are wait between 2 to 3 months before you start putting a lot of pressure on the sternum. If there's any signs that there's instability there, shifting, popping, clicking, then you want to have yourself assessed by either the surgeon or your cardiologist before taking a risk and going back to something physically intense. But if you haven't heard anything from the surgeon, everything feels fine, and you're 3 months post, then you're okay to resume light strength exercises and build on that again. In the meantime, though, you can still do cardio exercise, which involves light arm motion with the legs doing most of the work. And you can still stretch and do core exercises. So there is a lot of other things you can do. Just take the focus off the upper extremities and the chest. Okay? If you had stent, how many people in the room have had stenting or angiogram? Quite a few. So probably the other half, right? So those are meant to treat areas that have been blocked. And the only real concerns are you want to stick to lighter exercise for the first couple weeks. Again, the intensity low, to avoid the big spikes in blood pressure. So that's about 2 to 3 weeks, and then you can resume strength exercise. You don't have the same concern about the chest, so it is okay to resume. But you resume the same way. Start light, about 50% or half the load you used to, and then gradually build your way up. You also want to protect the incision. So again, as I mentioned with the intimacy lecture, if you had it in the groin or if you had it in the wrist, protect those areas until it's fully closed over, okay? Don't put any direct pressure on those areas until such time. How about pacemaker or ICD? Anybody had a device implanted in their chest? Okay, couple. These are a little less common, but it's important to know the settings in that device. You want to know if it's, for example, an ICD, when it would start monitoring and when a shock would go. Because you're going to want to keep your heart rate under those levels, conservatively under those levels. And if you do a stress test, they'll tell you that information, what your heart rate should be. They also do a device interrogation to know at what point, and they'll communicate that to you. Okay, the other thing, so if you have a pacemaker, that's really, there's different kinds of pacemakers, but it's just preventing your heart rate from going too slow. Generally, when you're exercising, your heart's not going to be beating too slow because it increases with exercise. Some pacemakers are fully in charge of delivering the impulse to the heart, and so they don't allow the heart rate to go up as you exercise. So just some different considerations. You may not see your heart rate climb, but you definitely won't see it drop because your heart pacemaker is keeping the bottom line going. If you had one implanted recently, though, in the last 3 to 4 weeks, you're going to want to avoid putting any stretch force on that. I would even be a little more conservative and say 6 weeks, where you're not doing any overhead type actions if you had a device implanted. If you're looking at pulmonary conditions now, or heart failure, how many people in the room have either had a pulmonary condition that they're dealing with, or heart failure related symptoms that they're being monitored for? Nobody? Oh, one. Okay. So when you're looking at those, you're going to want to probably break up your exercise into bouts of greater intensity and lower intensity, moving back and forth in that so you don't develop symptoms of shortness of breath or too labored in your breathing for an extended period of time. Okay, what about peripheral artery disease? Anybody told they have peripheral vascular or blocks elsewhere than the heart? Possibly, yeah. So if you're getting pain in those extremities, arms or legs, wherever the block is interrupting the flow to, then you're also going to want to do it intermittently. So, for example, if it's in your calf or your lower leg, you won't want to walk on a steep hill and keep going on that hill and try and push through pain. Don't go past a moderate discomfort and then drop the intensity and go back and forth between the two intensities. That'll be a way you can still push your heart, but the muscle issues of pain don't limit your ability to do that. How many people in the room have yes to diabetes? I'm looking at the number, it's one of those scam numbers too. How many people in the room have diabetes? Okay, quite a few, because it is a risk factor for heart disease. There's a couple things we want to look at when it comes to diabetes. One, that your blood sugar is in a safe range when you're exercising. We don't want it below 5 or above 17 to be thought about the numbers. If you're below 5, definitely don't start exercise. You want to be above 5.5. When you're done exercise, if you're below 5, you need to eat something. Try to eat 1 to 3 hours before exercising, and check your blood sugar before and after your exercise. Make sure those numbers are within a safe range. It is advised not to exercise an area that you inject. If you're on insulin-dependent diabetes, don't exercise that area right after injecting. Try not to exercise right before bed, because you're going to be fasting or not eating overnight, and then if you do exercise, you continue to burn energy at a higher rate, so you can run into hypoglycemia overnight. The other thing is you want to be checking your feet for issues of blisters and ulcers, because if you're walking and doing a lot of exercise, you can develop that under your feet, and you may not be sensitive to it because the nerves don't get quite the amount of blood flow they used to if you're diabetic. Okay, so a couple implications for that. Atrial fibrillation. Anybody have an irregular heart rate? Yeah. Is AFib the irregularity that you have? That's quite a common one. There are other irregularities, but the main thing is you won't be able to use an exact heart rate because the heart rate is changing so dynamically and regularly. But you still can use that talk test. You can still use the breathing test. And maybe it's irregularly regular, and you can get a range of heart rate. I mean, let's say my heart rate beats between 80 and 100 when I'm pushing myself, and it's fluctuating between that. You can still look at that pattern and say, okay, if I'm well above that, I know that's irregular to me, and then stop the exercise and treat that as a symptom in response to exercise, okay? And if you have no other symptoms, but your heart rate's racing well beyond what it normally does, you'll probably want to talk to your doctor about it and get it evaluated to see if it's a concern, okay? Because they can order tests that look at your heart rhythm more closely. How about angina? Does anybody in the room still have chest pain when they exert or even at rest? Yeah? So if you have angina, I went over the nitro spray usage, right? But let's say it happens at a very predictable point. When you push this hard, you get angina. Well, then you want to stay 10 beats below that. If it's unstable angina and it just happens whenever, you want to have clearance from a doctor and hopefully a clear angiogram or other tests that tell you that, okay, there's nothing obstructing you right now. You've gotten the key areas treated. And then you may be on a nitro patch or something like that to help manage it. You can pre-spray and take a little nitro spray before you exercise too. Those are some other options around it. But if it always happens at a predictable or stable angina at a certain point of exertion, stay a little bit below that. Okay? In your effort. So that was a lot of content, but I think that's what a lot of people want to see when they come here after having a heart event, right? Is there anything that I missed as far as I have this condition, it's heart related? How do I modify exercise based on that? That's a normal response to exercise. Yeah. You should have a blood pressure increase. There is a exercise hypertension too, which is too high even if you're exercising. Another good reason to do a stress test, because if you have exercise hypertension, it's identified and they stop you before it gets too high. Okay? If you're very hypertensive at rest, like close to 200 at rest, what does that mean? It means you've got very little room to increase your pressure and still be safe. So you want to get that blood pressure controlled and closer to normal numbers before you start exercising. Okay? Because remember, the chronic effect is your blood pressure is going to go down. But the acute effect is you're doing the exercises, it does go up. And that's where the risk comes in. Okay, I'm going to just touch on this. So if you have any of these issues before you even start exercise, these are reasons to not start. Okay? If you just get sick, you just get a cold, you get a fever. I mean, a cold is one where you can kind of take discretion. If you want to cut your exertion level down and probably the duration of your activity. But if you feel a little bit better by getting up and circulating and moving, so be it. But this is referring to more your body's battling something. Exercise is a stress. You don't want to compound the stresses on your body. Let it recover and restore itself. Okay, new onset of angina. If you haven't had angina and you develop angina while exercising, or before you start exercising, don't proceed and do an exercise session. If you develop a new arrhythmia, your heart's beating irregularly, or if you have muscle, joint, or bone problems that haven't been properly assessed that could be made worse by increasing your activity. So if you had like a serious ankle injury and it's really unstable and you're not sure if you should exercise on it, I would suggest that you can exercise all your other areas, but you should get that evaluated before you start an exercise program. Okay? Signs and symptoms of overexertion. That's going to be on the next slide. Or recent hospitalization without consent from a doctor. So if you've gone to hospital for another medical issue, anemia, whatever, something else that isn't specifically related to your heart condition, and you're not sure if you're safe to resume exercise, talk to your doctor before you start, okay? Overexertion. So if you get chest pain, back pains, neck pain, all that you think might be heart related, stop the exercise. It's going to be the same as the intimacy, guys, so I'm not going to beat this up too much. Short of breath as well. There's a couple more on here, like dizziness or faintness, confusion, visual disturbances. If something irregular is happening that affects how your head is functioning, your brain, your cognitive functioning, or your heart, those are the signs that you want to stop exercise for. Okay, and that's what they could look like. Go ahead.
I've experienced some of that dizziness
Yep.
when I'm walking. I'm
Yep.
trying to do a brisk walk, and then I find that I'm kind of going over here to the side or whatever. And I've just been thinking that that's due to my bisoprolol, because I've heard that that can make you feel dizzy.
Well, do you feel it at any other time or just when you're walking?
Just when I'm walking, and I'm trying to walk, briskly.
Yep. So did you warm up first is another question.
Yeah, I started out
Like a
slow.
5 to 10 minute period where you went easier.
Yeah.
Then you shouldn't have dizziness in exercise. It could mean you're overexerting. So that you're trying to push, but maybe you're pushing a little bit too hard for what your system can tolerate right now. Because it is an indication that either your pressure is coming down a little bit, you could stop and take your blood pressure and see if it's lower than it normally is. That could be an indication that it's a hypotensive episode. Or it could just be lack of flow to the head because your heart's working so hard to pump to all the other working muscles that not enough is returning to the head.
Okay. Yeah, because I'm having a little bit of vertigo, it
Yeah.
feels like, and I'm
If you haven't been as active as you're trying to be now, I would just introduce it a little more gradual and maybe do some intervals too. Like I said, vary the intensity. So instead of going continuously at a brisk pace and then at 5 minutes in you start to feel a little bit symptomatic, start with 2 minutes on, 2 minutes off, 2 minutes on, 2 minutes off, where you're walking brisker for 2 minutes and then slowing it down and walking easy for 2 minutes. Not complete stops, but varying the speed. Maybe you go on a varying hill or slopes, right?
Yeah.
Just a strategy in case that's what the cause is. But it sounds like if it's only an exercise and it's related to how hard you're pushing, that it could be related to overexerting at this particular time in the program. Overtraining. So if you continue to ignore symptoms that you're doing too much in session, then you can have some other negative effects creep up. Like, even though you're exercising, you're not improving. Well, your performance is going down because you're not allowing proper recovery between your workouts. Or you're doing too much in your workouts and it can't recover even with the amount of time you're allowing. You get other symptoms related to hormonal changes, like change of attitude or change of appetite, or decreased immunity. Because I said it's a stress, if you don't allow enough recovery time in between, that stress will be negative and cause you to get sick more often. You won't fight off bugs as well. General fatigue or malaise, like you don't feel like you have the energy to go and do the exercise, or you're nodding off and napping quite regularly. All signs that you could be doing a little too much for your routine. Okay, so I did talk about this. If you have symptoms and they last more than 5 minutes after resting, then you call 911. If it's chest pain related or angina related, consider a nitro spray after 5 minutes, and then call 911 if it's still there after 10 minutes. So that's basically a summary of what this slide is. Now, I guess I could go in a little more detail about using the nitro spray. How many people in the room have a nitro? Okay, great. If you have any plaques, if they're mild or moderate left, or even if you have stenting or even open heart, like if you have cardiac condition where it's CVD, coronary artery disease, where you have obstructions or they could return, I mean, you're on pills that help you prevent it recurrence, and if you do all the lifestyle stuff, it can help. But if these plaques progress or get worse, and you develop angina, it's important you have this nitro spray. It's like your good luck charm. You don't need it unless you need it, right? So if you need it, stop the exercise, see if it subsides after 5 minutes. If it doesn't subside, like I said, prime it first, spray it into the air, then under the tongue, don't spray it on the teeth. Wait 5 minutes, then if it doesn't go away again, spray a second time, call 911. By then, time is muscle, and you don't want to risk heart muscle damage to occur. So that's a little more detail about the nitro spray. So, long list of work cited there. We still have 5 minutes left. Is there any questions before we get into the open forum bit? Okay, so I know it's a lot of information. Again, if you want to revisit some of this information, it's on the website, on YouTube. Search cardiac rehab, Fraser Health. If you put those terms in the search bar, it'll bring you to our lecture series, and they're all kind of connected to each other, so you can find the exercise topic that way. Okay, so I hope to see most of you around the other aspects of our program, the exercise program. I believe everybody can benefit from doing some monitored exercise before they go off and do their own independent exercise. Thanks for your time and attention, everyone.
Okay, so stay seated.